our channel, Cool Bros. Tarun,
Varun,
Aaron.
So in this video today we are going to be talking about a very, very important topic. It is about the coronavirus vaccination, and for that us three have invited a very important person. And you know what's happening all around the world? But in Britain they've just started to have a coronavirus vaccination, and we are going to invite a guest who has actually had the vaccination himself.
So here is our important guest, and he is a little bit shy. It's because this is his first time in the recording studio, and so but I have dragged him in here and to make him talk for you guys. And so introduce yourself, Daddy.
Hey guys, I'm Dr. Vijay Gupta, a consultant in anesthesia and intensive care medicine, and I've been working in UK in NHS for the last 15 years. I've been heavily involved in management of COVID in the last 10 to 12 months. So yes, I have some information to share with my boys.
Daddy, so we know you had your coronavirus vaccination a few days before. So can you please tell us your experience about that?
Of course, Adi, I can share my experience with COVID vaccination that I had last week. Vaccination is a massive achievement, I would say, in prevention and management of COVID. We are fortunate enough to have this vaccine available in England. So obviously we don't have a lot of vaccine doses available for everyone in UK. So the government has to prioritize the number of vaccines that we have, the number of vaccine doses that we have. That has been prioritized to key workers and people who are more than 80 years old. So as you know, your dad is a doctor, so I had that priority given to me, fortunately. Of course, I did have COVID myself, deadly COVID, about 10 months ago. Doesn't matter, I'm still working in the hospital, so I should be prioritized. Therefore, I have received the vaccine offer from NHS. I was fortunate enough to have it on about a week ago. I was really lucky enough. It was quite interesting experience. Obviously, I did have vaccine before, but this was quite a different experience.
Yep.
Do you want to know anything specifically about this vaccination?
Yes, I do.
Yeah, but when did the deadly coronavirus go?
Ah, right, okay. You did see Daddy struggling with deadly COVID in March last year, yeah? Soon after this pandemic began, I contracted this virus, perhaps from my workplace. So I had it, so I did have severe fever, cough, and I was tired. I couldn't breathe very well. So you knew how Mummy looked after me. I stayed at home, and I was at home for 10 days just struggling with my breathing. So it was quite deadly. I was lucky enough to have survived that. Anyway, so that was 10 months ago. I'm not sure from the antibodies that my body developed during that time that is still there. So I am still advised to have vaccine by the government, by the people. So obviously I should be having that. So I had it last week, fortunately. So I had the vaccine Tuesday last week. It was fine first 12 hours. Then, as expected, I did have some symptoms, following vaccine. So I had a bit of sore arm. I had some temperature, which was all expected. So you are expected to have some mild side effects. So sore arm, temperature, and you might have some sore throat and flu-like symptoms, tiredness. But in my case, it was a bit more than what I expected. I was feeling really tired, muscle pains. So it lasted for about 48 hours, I would say. Then it was fine. So, it's a small price to pay for what you get. It does provide good, protection against the COVID. So it's important that we accept this minor side effects and then take the vaccine. So I did have it.
So, Daddy, so how did you feel? So how did you feel when you actually went inside the room?
Shy?
Not really. I wasn't shy. That was organized at my workplace. I know the people. I knew how it was going to be delivered, the COVID vaccination program. So yeah, we have asked for volunteers in the hospital. Group of people, medical and non-medical team, because we are going to be delivering a large number of vaccines, not only to the staff working in the hospital, the place that I work, we have more than 3,000 staff. The priority is to provide vaccine to the staff looking after patients first, and obviously we will be extending our service to the public. And of course, in the place where we live, there are a lot of public centers, public centers set up to provide COVID vaccination. But the place that I went to, is part of my hospital, the management place. So I went there, had vaccine. It was like a usual jab, really. I just had that on my arm. I was a bit shy because there was a lady who gave the vaccine, so I had to remove my shirt. But I had the vaccine. It wasn't painful, little sharp, and that's it. You know what? 6 to 12 hours later, I began to have the problems. So I didn't experience nothing whatsoever. I was absolutely fine as I was normally. But then, just half a day later, I began to have sore arm, fever, and some tiredness, muscle pains. It was a bit bad. I had to take some paracetamol and rest.
Did you scream when you had put that vaccine, when that lady put it?
You guess what I would have done?
I think you screamed.
Not really, my little boy. I didn't. I took it easily. It wasn't that difficult. So yeah, it was easy to take the pain. Perhaps if I were you, I would have probably screamed. But I'm proud of you guys. You never cried when you guys had your jab.
So, Daddy, so it's time to move on to the next question. So, and remember you just said like a few symptoms or side effects that you just had. Is there any other small side effects?
Yeah, I explained, some minor side effects that I had are pretty much experienced by many others who had COVID vaccine. Of course, there are some serious side effects. People can develop, serious reaction to this injection. So it can cause breathing problem. It can cause, issues like, we have anaphylactic reaction, severe allergic reaction, basically. So some people might experience that, but there are treatment available for it that shouldn't stop people from having COVID vaccine. Otherwise, there aren't any major side effects reported so far, which is good.
So time to move on to the next question. So if you had the coronavirus jab, so would you still get coronavirus?
COVID vaccine does offer protection. However, you can still get COVID because the protection rate is only 80% with the first dose, and if you have had second dose of the COVID vaccine, the protection is up to 90%. So even if you had 2 doses, you can still get, there's a 10 to 20% chance that you may get COVID again. And let's not forget, you have COVID vaccine. It takes about 1 to 2 weeks before your body generates the protective antibodies that will protect your body from the COVID. So it does take that 1 to 2 weeks, during which period you are still likely to get COVID if you don't follow the rules, the isolation rules and social distancing, the standard, hand washing, face covering, and social distancing. We should follow that. Any other questions?
Well, so Daddy, so you mentioned something about 2 coronavirus vaccinations. And can you explain that in like a little bit more detail?
Oh, you mean 2 doses of COVID vaccine? Is that right? Okay. Right. So we have so far in UK 3 different types of COVID vaccines approved for our use. So the way that has been developed, you got to have 2 doses to give you good protection. With the first dose, the predicted protection rate is up to 80%. So you are meant to be having second dose, and that will, with the second dose, you are likely to get 90% protection against COVID disease. So the second dose usually, offered to people within 2 weeks. However, given the current shortage of vaccination, the government has decided to extend the duration to up to 3 months. So you could argue why that is. The idea is to offer the vaccine with the available dose that we have to every single person in the UK to provide them at least 80% of protection. You could say this way, you've got 2 nannies in your house, you've got only 2 doses of COVID vaccines. This is what Professor Vitti said. That you got option now. You could protect 1 nanny with 2 doses. With 2 doses, the nanny is likely to be protected up to 90%. Or you can protect both nanny, just giving them 1 dose each, but the protection is only up to 80% each. So what would you prefer? Would you like to protect just 1 nanny 90%, or would you like to protect both nannies, although it is just 80% with single dose?
2 nannies.
Yes, and that is the whole idea. Why the scientists and the leaders in England have decided to offer the people the first dose so that they get this protection up to 80%. When you have that COVID vaccine, 80% protection plus, even if you do have it, the disease is not likely to be very severe and thus not likely to take you to a hospital. You might experience flu-like symptoms, but you can stay home. So this will take the enormous pressure on National Health Service currently that we experience of NHS really. So that is the whole idea. So we are all likely to get our second doses when we have the mass production of COVID vaccines within next 3 months.
But anyway, when are we gonna get vaccination?
You
For
mean
us?
the small boys?
Yes.
Right. Currently,
No, he's 10 times.
all of you, children. Okay. Currently, we know that the COVID disease affecting elderly, of course, other age group as well. Of course, some children, but it's not primarily affecting children. So the vaccine that we have developed aren't trialed on children yet. So it is available to adults, including pregnant women, breastfeeding women, but it is not rolled to children yet. However, that is our next step, clearly, to protect our youngsters, children, that the COVID vaccine will be trialed and expanded to children as well. All right.
And how safe is the vaccination itself?
Yeah, that is a very valid question. Clearly, we had this COVID started affecting the world population in December 2019. But where are we now? Just a year down the line, we have got vaccination rolled out to the population to protect us. This is probably in the medical history the rapid mass production of vaccination. Usually, it takes long for scientists to produce vaccine. It goes through very rigorous testing and testing the safety of the vaccine. It takes longer. It gets tested on animals first and then volunteers. But given how severe the pandemic is, we had to expedite the whole process. However, it has been tested on population more than at least 20,000 people. Every single vaccination production has gone through at least 20,000 volunteers before we declare the vaccine is safe and it is effective. So in England and UK, we have the regulation body called Medicine and Healthcare Products Regulation Agency, has approved the safety of this vaccination. So we've got 3 different vaccines available in UK, and that has been rolled out to, as I said, in the first phase, to protect elderly people over 80 years old, and also the people who are working in NHS, and also in other key workers and a high risk group in phase 1. But when we have enough vaccine, I'm sure it will be rolled out to other people in UK.
I think we covered up all of the topics, but is there anything else you want to add on?
Yeah, what I would like to say is, of course we do have a vaccine, but the vaccine is not a liberty ticket. You guys must realize we are still within the grip of the pandemic. It's not over yet. The NHS in UK struggling a lot. We still have a lot of patients in hospital, and the system is stretched. The staff are relentlessly working. Everyone is tired. So the public should take it very seriously. And what I would say, as I said, availability of vaccination is not a liberty ticket, and you guys must stick to the national lockdown rules. Please wash your hands. Please use face mask, and absolutely follow the social distancing rules. The 2-meter distance, and you guys must follow the national, the lockdown guidelines and rules. Do not ignore. We are absolutely struggling in NHS while we are trying to protect our patient, while trying to save lives, and you must take it seriously. And that's what my message to everyone, including you guys.
So thank you, Daddy, for your time here. And we know that we have all been through a very, very hard year. And so me and my brothers have certainly learned a lot. And we hope that you viewers have learned a lot. It's because this has been a very important video.
Thank you, boys. Thank you.
Bye guys. Thank you for watching.